Here's the question. If you have post-viral fatigue syndrome, CFS, long COVID, fibromyalgia, POTS, or similar illness, what do you do to recover? Many people discuss various physical treatments, which can offer some relief, but often lead to a real roller coaster of results. After all, a one-size-fits-all cure remains elusive, doesn't it? Others explore mind-body techniques, which might seem unusual or even mystical to some, especially when considering the physical nature of these illnesses. Again, the outcomes vary. So let's dive into how these strategies may fit into your recovery, why results can differ, and how to navigate these approaches effectively to enhance and accelerate your journey towards healing. In case you're new to the channel, I'm Dan Neufer. I'm the author of CFS Unravelled and the creator of the ANS Rewire Recovery Program. So let's start with talking about mind-body approaches for recovery. The term mind-body is broad, often applied to a wide array of health conditions. Now, I don't deny that some people have some amazing and unexplained results by doing mind-body approaches, whatever that means. Often these kinds of things are described as unexplained spontaneous recoveries. And such unexplained recoveries can seem quite extraordinary. But placing hopes on spontaneous recoveries, especially without any consistent results, well, I think that presents a significant gamble for those facing serious health conditions. Maybe if there's no other treatments, that's okay. Maybe to do it in a conjunction with a treatment, okay? But if you get diagnosed with diabetes, heart disease, or some other serious illness, yeah, perhaps it makes sense to focus on treatments and strategies that we know work reliably. Yeah, just saying. So why is there so much talk about mind-body approaches for fibromyalgia, CFS, post-viral fatigue syndrome, POTS, long COVID, and these types of conditions? Well, because many people make recovery progress with these approaches. But I think we need more context and perhaps a change in language. The reason why these kind of approaches are relevant is because these illnesses are neurological illnesses, specifically a dysfunction of the autonomic nervous system. Not solely neurological, which is what makes this illness so complicated and why the illness has been somewhat mystified over the decades. Because there are usually many more biological dysfunctions in the body that result from the main driving dysfunction of the autonomic nervous system. So a key strategy to resolve this is to retrain the brain to behave normally, just like people do when they have a stroke or a car accident or something like that. They learn to talk, to walk, and they do this by retraining the brain. The difference is that here we teach the brain to behave more normally to stimulus, specifically to stressors. Now, stressors include physical things like infections or exercise, or things like concentrating, doing work or study, or even emotional things. And interestingly, the brain's response to stressors, whether positive or negative, is remarkably similar. So many people try such things with mind-body programs, and some do great. Some do okay, and some don't benefit at all. Understanding why that is the case is key, and it's something I feel is essential to understand, which is why we covered in detail in the ANS Rewire Recovery Program. We actually educate people on some of these details first up in the free introductory lessons. Check out the link below if you haven't seen them yet. Yet, there is another perspective focused solely on physical treatments. Because there are so many physical dysfunctions, the list for these is really large. People work with doctors, integrative or functional medicine doctors, naturopaths, and other healthcare professionals. They treat infections, like SIBO or other gut issues, hormonal problems, metabolic problems like mitochondrial dysfunction. They look at inflammation in some cases, intolerances. The list is seemingly endless. Also, many people have mental health challenges in parallel to these conditions. There might be things like ADHD, depression, anxiety, or even other mental health disorders. Okay, now you have some context. So, unlike both of these camps, the mind-body camp and the physical treatment camp, what I'm saying is that we need to do all of these things at the same time. Now, whilst physical treatments don't tend to cure people, they can drastically reduce symptoms and help the body and nervous system to recover. This is important for recovery because doing so allows the brain training to become more effective as the physical treatments take the pressure off the nervous system. This is not just the case for physical treatments, but also treatments for mental health issues, which may be done in parallel. But it also works the other way. That's one reason why health professionals globally recommend our program, because they suddenly observe that some of their patients respond more favorably to treatments. And they notice that this happens when it's complemented by the brain training exercises or education around these physical approaches for recovery. In fact, this is the key thing we do, is to encourage people to re-engage with failed physical treatments. And the reason for this is because as the ANS starts to normalize, the body is able to recover, and the very same treatments that previously seemed ineffective often become effective. So people often ask me what they should do: brain training or mental or physical treatments. And I say, yes, do them all. And that's because I often see that when people just focus on one, their recovery is often limited. They hit this glass ceiling. And it's not just the case for the overall recovery, but also with what they're treating, including the mental health issues. You know, the best way to think of this is like climbing a ladder. But rather than just one, you're climbing two ladders. One for ANS normalization and the other for physical and mental dysfunction. Because being so ill exacerbates or causes mental health issues, recovering from the illness as a whole will make recovering from mental health issues easier. You're much less likely to be depressed or anxious if you're catching up with your friends, jet skiing, working, or going on holidays than if you're lying on the couch all day feeling awful and unable to work or play. Similarly, your gut issues like intolerances to certain carbohydrates or ability to digest certain proteins is much less affected if your nervous system is regulating your gut normally. Then treating any dysbiosis or infections become meaningful to restore gut health. Otherwise, the problems just return. So as you normalize ANS function, you can more easily fix physical or even mental health issues. One step up. And then as you improve physical dysfunction and or mental health issues, you can more easily normalize ANS function. Another step up. So one supports the other. But if there's a big stressor, whether mental health or physical, not addressing this can really hold us back with ANS normalization and brain training. This would also apply to other brain training. Now, for example, someone completely overcome by anxiety or depression might not turn up or engage fully with doing their rehab to learn how to speak or walk. But with ANS dysfunction, it's also physical things. So if your blood sugar is totally out of control, or you have crazy low hormone levels or rampant infections, it's really hard for your nervous system to normalize because it's too busy trying to put out these fires in your body. Sometimes these physical or mental issues need to be addressed, and you need to make enough progress to be able to engage in brain training effectively. And vice versa. Setting a foundation to reduce nervous system pressure and triggering of flare-ups and making enough recovery progress is sometimes what we need to sort these mental health issues or physical dysfunctions out with treatments. So my message is this: work on all fronts. But if you're really stuck, then focusing on what's causing you to be stuck can be really essential. If you look at this climbing two ladders metaphor, you can see you can't keep going with one leg on one ladder if the other leg is stuck. This is part of the key foundational understanding of how these illnesses work and how we can build a comprehensive recovery approach and adjust it to our own situation, our current situation. So you can see that we need to be flexible and continue to adjust our approach even at the end. I often see people remove supportive treatments too early or hang on to them too long. We need to do these things at the right time and give the nervous system the chance to recover more fully. Too little or too much support can hinder this, depending on where you are in your recovery. Have you found this in your own recovery journey? If you're still listening, please give this video a like and make sure you're subscribed and are getting the notifications so you see all the future videos. And perhaps you tried something and it didn't work, and then suddenly, sometime later, you made progress with the same treatment. I wonder what your experience has been. Or did you make progress with brain training, then suddenly you plateau? Does the climbing of the two ladders analogy help you understand what we're talking about here? Please leave a comment. I'd love to hear what your experience has been, and let's share it with others. And my message to you is, it's okay. It's normal to get stuck at times with recovery. The key is simply to be flexible and to adjust your approach. Just keep going and make every choice your best choice. I'll see you in the next video.